Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. As you know, we have been doing these programs and talking extensively about the COVID-19 pandemic. And we encourage you to send in your questions or comments. And if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275. Or you may send an email to docandcovid@gmail.com. So we're now in the latter part of February 2021, and around the world and in Guyana as well, our focus in the COVID-19 fight has shifted a little bit now to include a different phase, which is the advent and utilization of vaccination. Today, as you see, I am wearing my mask that covers my nose and mouth completely, and this still remains a bedrock recommendation in the fight against COVID-19. Wear the mask to cover both the nose and the mouth. I will take mine off using the straps as we continue this conversation because I'm alone here while we're doing this recording. There's no one here to put me at risk, and I am putting no one else at risk. So the big topic that we are going to be looking at in the next couple of weeks, the next couple of months, until we get the better of COVID-19, is really the role of vaccines and the vaccination process. Many of you would have known, or you might have seen in the news recently, that we have rolled out the vaccination program in Guyana. And we were very lucky, and we benefited from the generosity of our CARICOM sister state in Barbados that donated a number of vaccines. I believe it was 3,000 doses from the AstraZeneca production line. And we are very grateful to have benefited from the generosity of Barbados in that regard. And so we rolled out this vaccine to look at the frontline healthcare workers. And by and large, that has been a successful rollout. And many of our healthcare workers would have benefited and taken this vaccine, despite some concerns that that would have existed. And these are reasonable and understandable concerns. But at the end of the day, we see, having looked at the evidence across the world, that the benefits outweigh the risk of these vaccines. And we always have to evaluate that ratio, where benefits versus risks are looked at. And for all the vaccines in the COVID-19 fight, the benefits seem to outweigh the risks significantly. And that is why we use it in ourselves. That is why we use it in our patients and the population in general. I myself was among the first to have received the COVID-19 vaccine from AstraZeneca, and this was given to me at the Georgetown Public Hospital Corporation. We had a number of staff at the Georgetown Hospital that received the vaccine. Two centers were set up, one at the Liliendal or the Ocean View COVID facility, and the other one in the Georgetown Hospital compound itself. Many of my friends, colleagues, doctors, nurses, workers in the hospital, those who are considered frontline health workers, would have taken this vaccine, and many of us have very similar stories to tell. The experience was quite not much different from taking any other vaccine. I would have had in my lifetime vaccines against the measles, mumps, and rubella, or the MMR. I would have had hepatitis vaccines, flu vaccines. The experience is pretty much the same. It's an injection given in the right shoulder or left shoulder. In my case, I got it in the left shoulder. I'm a right-hander, so I needed to use my right hand more often than left to do normal basic functions. So I prefer to take my vaccine in the left shoulder. And the majority of the population generally are going to be right-handed, so they may want to consider taking vaccines in the left shoulder. So when you go into the center that is doing the vaccination, there is a team there made up of clerks and nurses and other healthcare professionals, and they would ask you certain basic, simple questions. Are you allergic to any vaccines? Have you been admitted to hospital with any severe allergic reactions to anything? Have you had COVID recently? Your name, date of birth, your address, telephone numbers, all of the basic pieces of information that you need to keep accurate record. Having an ID was a bonus, but I don't believe it was a requirement. Once you're honest and give your answers, that is all that is needed. The healthcare workers who are taking the information down, they're also going to ask about your general health status. Do you have any medical condition like diabetes, hypertension, heart disease, etc., kidney disease? Do you take any medications, and what are you taking them for, etc.? So basic screening questions to determine whether or not you are a good and suitable and safe candidate to receive the vaccination. We got the AstraZeneca vaccine, and that's what we gave to our healthcare workers. So you complete this part of the interview process, then you enter where the nurses are. You're asked to sit in a chair while you wait your turn to be vaccinated. When you get to the nurse who is doing the vaccine, they will actually show you the vial that is about to be used for you. And the liquid is in the vial. It's kept in normal refrigerated temperature, not the -70. And they show you, they explain to you what they're about to do. You expose your shoulder, right or left. In my case, it was the left shoulder. The nurse then cleans the area with alcohol swab. She pulls up the injection in a syringe and then injects into the left shoulder. The entire process of the injection, etc., lasts just a couple of seconds. And then she puts something on there to prevent any leaking, any bleeding, etc., which doesn't really happen. And at the time, I had a very good nurse who gave me my vaccine. I didn't quite feel the injection. And that was, that is a testament of the nurse's experience and expertise in doing this procedure. So I was very grateful to get one of the better nurses who give vaccines to patients. Now, immediately after the vaccine was given, when you look around the room, you will see that preparation is actually made there just in case anyone has a bad reaction. There is a bed for resuscitation just in case it's needed. There is oxygen. There is a crash cart just in case somebody has a terrible reaction, needs to be intubated, resuscitated, etc. All of those things are put in place to ensure the safety of patients who are going to take the vaccine. After you take the vaccine, you are then asked to wait in an area for about 15 minutes. That area, you are monitored, and basically people keep an eye on you just to make sure that you're not going to pass out, you're not going to develop any abnormal adverse reactions, you're not breaking out in hives, you're not developing shortness of breath, you're not starting to sweat excessively, not developing itching, etc. These are all important things to look for in the patients immediately after the vaccine. To the best of my knowledge, we have not had any significant adverse reaction in our vaccine rollout in Guyana, and we're very grateful for that. So basically, when we ask about the vaccine experience, it is a comprehensive process that starts with an interview. It starts with people finding out about you as a person, your medical condition, etc. And after receiving the vaccine, you are then observed for a minimum of 15 minutes before you're allowed to leave the area. Now, after I got my vaccine and I was able to leave the observation area, I went straight back to work. We had patients in the clinic to go and see. We had patients to operate on later in that day, and this continued as a normal day. Later in that evening, about 8:30, 9 o'clock, I started having some chills, feeling a little cold, and I anticipated this. It happens a lot in any kind of vaccine that you take, not just COVID-19 vaccine. You can develop a little bit of a fever. So you took 2 Panadol or Tylenol or paracetamol, they're all the same thing. And it took care of fever, it took care of the chills, and whatever slight discomfort there was in the shoulder at the time, it took care of all of that. So 2 Panadol was able to take care of all of the worrisome side effects that we experienced, or myself experienced. And that process, I repeated that in the morning before I went to work again. And since then, I've been quite fine. This is over a week and a half ago. And so we're very pleased that my experience has been very much similar to that of the majority of my colleagues. I know some would have gotten that fever and chills reaction starting a little bit earlier in the day, and some would have not experienced it at all. So different people respond differently, but it is the same for almost every vaccine that you receive. I would have received previously several times, several years in a row, the flu vaccine, and it's the exact reaction you get. You get a little bit of fever, some chills, you can get some sniffles, etc. It's the same reaction you get with the COVID-19 vaccine versus the flu vaccine, the hepatitis vaccine, etc. There's always some response that the body does that makes you feel a little bit different after receiving the vaccine. And that is expected, that is normal, that is your body developing normal defense mechanisms for when you encounter the real thing. That is the principle of vaccination in general. Now, there's a lot of hesitation among some healthcare workers and members of the public to take the vaccine. And hopefully, now that I've explained to you some of this and some of my own experience while taking the vaccine, some of the questions and some of the hesitancy would have been somewhat allayed, and you would feel a little bit more comfortable when it's your turn to take the vaccine. We are about to get a large number of doses again coming into the country, and so the rollout continues. We will have persons probably in the over 60 or over 70 age group as the next priority group, and then we continue to come down to the younger and younger age group. So when it is your turn, remember that you have a right to refuse, of course, but I want to encourage you that you should take the vaccine because it is the best that we have right now anywhere in the world to actually combat and fight against the COVID-19 pandemic. In fact, countries that have vaccinated a large number of their population, especially in places like Israel, there has been a 30% decrease in hospital admissions almost within the first month of vaccinating their population. And most recently in the UK, we saw a big drop in hospital admission for COVID-19 in persons who would have been vaccinated versus those who would have not been vaccinated. In those who would have taken the AstraZeneca vaccine, there was a 94% reduction in hospitalization for COVID-19 versus those who did not take the vaccine. So we're already seeing real life, real world experience that shows us that there is an overall benefit in taking the vaccine in terms of reduction in the need for hospitalization. So I hope that this would have answered some of your questions and relieved some of your anxiety as it relates to taking the COVID-19 vaccine. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining me today.